Hey guys, Joe Tillman from the Hair Transplant channel, and this is question number 3 from my Q&A session with Dr. Mittal when I was in his office last year in London, UK. Now, this is number 3, but there is 10 questions in total. I've been doing short form content on these, but let me know down in the comments if you'd like to see these stitched together into one long video when I'm done with each individual one, presenting them to you. Also, hit the like button down below and subscribe, and let's get to the video. You're telling me earlier in discussions that you're seeing a rise in repair cases. Can you elaborate on that more?
Yeah, I mean, look, I think that there's, especially in the UK now, I think that there's a lot of clinics offering high volume, not even budget procedures to be fair, just volume, you're one of 20, one of 30, okay? Mm-hmm. And as a result of that, there's a throw-off. Statistically speaking, there are going to be, 1% or 2% of patients, regardless of who you go to, are not going to always get the best possible outcome. Mm-hmm. And as a result of the volume that's being churned out by some of the clinics in the UK, there's a lot of repair work that is, not necessarily completely repair work, but some repair work that's being born out of it. Mm-hmm. as such, not just, improving density, but sometimes patients have off angles. It's funny, I was speaking to a patient who has already had a punch out session from the Hattigan clinic. Mm-hmm. Really beautiful looking scars, but you can't see the scars because he's had a
beautiful lack of scars.
Beautiful lack of scars, 3 punch out sessions, but he got operated on in the UK first time round. Shouldn't have got the hairline that he got, but they did whatever he wanted them to do. Mm-hmm. And now after the punch out session, he's hoping to get sort of more natural looking hairline. That's what he's going to be coming to me for. Yeah. Look, I think there is a huge rise in repair work, and I think that it's harder to get things right a second time than it is to get it right first time. Kind of boils down to what I said in the first instance, setting the expectation right, making sure that you over deliver. But if I'm selling you a hair transplant surgery as opposed to giving you a medical opinion on what a hair transplant surgery should give you for the long term, then I'm going to say everyone's a candidate, come on in, today's Monday, I'll do you on Tuesday. Yeah. And I think that's hugely wrong. I think that's where people start to become a little bit unstuck.
Yeah, and the issue with repair cases is I always tell patients that if you have the wrong first procedure, it'll take 2 more on average procedures to get back to looking like you didn't have one to begin with, not getting you to where you wanted to be with your first one. Yeah. So that cheap hair transplant can wind up being 3, 4, 5 times more expensive than you ever imagined.
But it's not even that they're cheap, Joe. They're not cheap. Sometimes, there are, of course, there's cases where people have gone cheap and whatnot. But generally you find that those patients can't actually afford the repair work that it's going to cost anyway. But it's the patients who've paid decent money, substantial money to get a procedure done, and as a result of it, then got botched. That's the real problem. And botched is I don't like that term. It's it's an inflammatory term, so we won't use botched. Botched is not the right term.
And it's used way too generally, even for situations where it's not even remotely justified, as far as I'm concerned. Yeah. Poor growth or a little bit of low density, botched.
Yeah, that's wrong.
No, not so much. Yeah.
So those are the terms that we should use. Low density, poor angles, lack of growth, not botched. They've still got some hair there, but it could be better.
Fair enough.